A common injury for runners is called runner's knee. How original, I know. I am Dr. Christina, the Picky PT. I'm a physical therapist. I'm also a runner, and I love to tell you how you can prevent common runner's injuries and reduce pain when you have common runner injuries. So if you like this type of content, make sure to like and subscribe to this channel so you can learn even more in the future. So runner's knee is most often described as pain that is just below the kneecap and kind of tugs and pulls and can feel really achy when you're doing things like running, but also doing things like prolonged sitting, or if you are trying to do squats or lunges, you can often have that pain right here under the kneecap. What it's caused by is tightness in your quad muscles. And quad muscles can get tight either from inflexibility and not stretching enough, or from overuse of certain quad muscles over others. As you may have guessed, with your muscles being called your quadriceps, there are 4 of them. And more often than not, people tend to overuse their outer quadricep muscles and underuse their inner quadricep muscles. That then causes the kneecap to not pull evenly up and down, but kind of tug off to the side, being pulled by those tighter, more active muscles, which is going to tug unevenly on the tendon that attaches your kneecap to your tibia. And that is what causes runner's knee. So in order to help with runner's knee, you're going to want to make sure to stretch your quad muscles and get more flexibility in them. You're going to want to make sure to strengthen your inner quad muscles to counterbalance the overuse of your outer quad muscles. And you're going to want to improve your running and walking form to use more of your glutes and your hamstrings rather than relying on your quads and your hip flexors to propel you forward. If you make these changes, it should reduce the pain that you're in right now and prevent future runner's knee issues that you may come across later on. So the very first exercise that we're going to do is a straight leg race. You're going to lay on your back and have one knee bent and one knee straight. This bent knee is able to protect your back from arching too much because, as you may notice, if I put both legs out, my back will arch more, and as you're doing leg races, you can really strain your back. So instead, we're going to bend the non-moving leg. You're going to want to, instead of keeping your toes pointed straight up, like you'll see a lot of people doing their leg races, in order to target your inner quad muscles, you're going to turn those toes out and keep them pointed out as you do your leg raise. You'll notice this gets you more engagement in that inner quadricep muscle more than feeling it on the outside. As you do this, you also want to use your core muscles to teach your body to use your core muscles as you're running and not just rely on your hip flexors to do this. So as I lift, my toes are pointed out. I'm pulling my pubic bone up towards my belly button as I lift the leg to the height of the other leg. And then as I lower down, I'm going to try to hold the core engagement that I gained on the way up. I'm going to do it again. Toes turned out, pubic bone pulled up as I lift the leg, and then slowly lower it back down. I typically have people start this with 2 sets of 10 and then progress themselves to 3 sets of 10 and then 3 sets of 15 if by the end of the set you feel like you could keep doing more. By the time you feel comfortable with doing 3 sets of 15 all in a row and you don't feel like you need a break in between, you're ready to go ahead and add resistance such as ankle weights, or add resistance by completely changing the exercise and getting more quadricep strength on the inside with a different exercise. So as a way to keep your quadricep muscles flexible so you don't end up with runner's knee, you're going to do a standing quadricep stretch. So you may need to hang on to something if you don't have good enough balance to do this without hanging on to something. You're going to grab the top of your foot, pulling your heel to your bottom, and extending your hip as you do so. What I mean by extending is you don't want to stand with that hip flexed forward because your quadricep muscles are actually a 2-joint muscle. They cross your hip and your knee. So when you extend that hip, you get an even better stretch in those quadricep muscles. In order to stretch the outer and inner quad, you can also pull your heel more towards the outside to get more of that inner quad stretch, and you can pull your heel more towards the inside or the center of your bottom to get that outer quad stretch. Remember, with any stretches, you want to hold for 30 to 90 seconds in order to get actual lasting benefits from that stretch. The last thing you can do to avoid runner's knee is address your running form. If you notice that as you're running, your hips tend to lead your run and your knees come up high, you're gonna end up overusing your hip flexors and quad muscles in order to push off as you're going forward. But if instead you focus on leaning forward slightly and squeezing your bottom each time to push off and propel yourself forward, you're going to underuse your quadricep muscles and make sure that you are not using them more than they need to be used during your run. If you try stretching your quadricep muscles, strengthening your inner quads to equal the strength of your outer quads, and changing your running form, but you're still not seeing a change in that pain underneath the front of your knee, you will need to make an appointment with a neuromuscular expert, a physical therapist, because you may, one, need hands-on treatment to release the tension that is in your quadricep muscles, or you may need someone to personalize a plan for you, watching how you typically move and picking up on compensations that can't be picked up on a YouTube physical therapist who isn't watching how you move.